Hello, very welcome to my second video lecture about contraception. In this lecture, today I am going to talk about types of hormonal contraception. We will discuss indication and contraindications. We will talk about emergency contraception, and finally we will talk about male and female sterilization. Let us talk about hormonal contraception. This means that the type of contraception which use hormones to prevent pregnancy. In the previous lecture, I talked about mechanical contraception and barrier contraception. Now this type of method, it uses hormones which called progesterone and estrogen, and these hormones or this preparation either in form of oral tablets, either combined from both hormone or single pills from one of these two hormones, either parenteral like injections or injectable hormones, or devices like intrauterine devices, implant, vaginal ring, or transdermal patches. Hormonal contraceptions, as I told before, it could be in either tablets, which we call pill. This pill or tablet either combined or single, combined preparation or single preparation. Combined preparation, which we call combined oral contraceptive pills, COCPS. This preparation either monophasic, biphasic, or triphasic, and the single preparation either from progestin only pill or estrogen only pill, which we call BOP. Progesterones. As you know, progesterone is one of the important hormones that regulate ovulation, and there are many synthetic types which for medical uses, and these are divided into first generation, second generation, or third generation. First generation like norgestrone, and second generation like levonorgestrel, and third generation desogestrel, gestodine, and norgestimate. What is monophasic, what is biphasic, and what is triphasic? Monophasic means this preparation or this tablet contains different concentration of estrogen and progesterone. Biphasic, it contains different concentration, varying dose of estrogen and progestin administered through 21-day cycle. This means that the tablet contains different concentration. And we have another preparation which low dose pill, which we call that estrogen esenyl estradiol. EE means esenyl estradiol less than 50 microgram per tablet. Triphasic also means that the hormonal dose of each compound vary over the course of the cycle. Minimum dose, they are using the minimum dose provided for which is effective for contraception. First 6 days, esenyl estradiol 30 microgram, levonorgestrel 50 micrograms. Next 5 days, 40, 75. Next 10 days, 30 to 125 levonorgestrel. This means that monophasic, similar concentration of the ingredient or the hormonal concentration for the whole tablets. Biphasic, different concentration, two concentration, and triphasic means that there is 3 different concentration of the hormone. First generation of oral contraceptive pill contains 50 microgram or more of esenyl estradiol. Second generation, this usually low dose of oral contraceptive pill We call it low dose oral contraceptive pill, and sometimes it contains 20 to 30 or 35 microgram of ethinyl estradiol. And levonorgestrel or norgestrel or norgesterone. The third generation contain newer lipid-friendly progestin, desogestrel, gestodin, norgestimate. Fourth generation of oral contraceptive pill containing drospirenone and desonorgestrel or norgestrol acetate. Mechanism of action of combined oral contraceptive pill. How it prevents pregnancy and how it will act. This usually inhibits ovulation. The first action of combined oral contraceptive pill, as you know, the progesterone and estrogen are important hormone with gonadotropin and hypothalamic pituitary axis and ovary. This is a normal axis to regulate ovulation. So inhibition of ovulation can affect this hypothalamic pituitary axis by adding estrogen and progesterone, and which can inhibit ovulation. Another mechanism of action is unreceptive endometrium. This estrogen and progesterone can let the endometrium unreceptive and prevent this implantation. The third mechanism of action is hostile cervical mucus. The progesterone, it will let the mucus in the cervix hostile, and the sperm cannot penetrate the cervical mucus and enter the cervix. Not all women can use combined pills because, as you know, estrogen and progesterone, it is hormones and can affect health of the women. So those who have, there is some contraindication, which we could say it is absolute contraindication, like migraine with aura, thrombophlebitis, history of coronary disease, diabetes with vascular complication, active hepatitis, liver tumor, and uncontrolled hypertension, and smoker, those with age more than 35 and smoking, and undiagnosed abnormal vaginal bleeding. All this is contraindicated. Contraception cannot be used with these conditions. Non-contraceptive benefit. What are the some tablets or this combined contraceptive pill or progesterone only pills or devices they found that they have another effect besides prevention of pregnancy. What are these benefits? First, it will decrease menstrual loss. Those who are suffering from excessive vaginal bleeding or menstrual bleeding, they can benefit from contraceptive pills. Dysmenorrhea, ectopic incidence decrease, and pelvic inflammatory decrease. Endometrial cancer also is protective for endometrium. Ovarian cancer, protective against ovarian cancer. Iron deficiency anemia because it decreases the menstrual loss. Benign breast disease, functional ovarian cyst, and premenstrual syndrome are improved by using contraceptive pills. Increased bone density and regularization of menstrual cycle. But they found that also these pills has interaction with other drugs like anticonvulsant. It will decrease efficacy. This drug, this is what we call drug interaction, drug interactions. If you are using contraception, if you are is a patient, means that the patient is epileptic and using anticonvulsant, and now he is using contraceptive, then the efficacy decrease. The efficacy of contraceptive drugs is decreased by anticonvulsant like phenytoin, carbamazepine, barbiturate, and also by antifungal and by antitubercular drugs. Some drug also efficacy is reduced by oral contraceptive pill like aspirin, methyl dopa, oral hypoglycemics, warfarin. Some drugs whose efficacy is potentiated some drug efficacy is potentiated by oral contraceptive pill, so we need to decrease the dose of the medicine, of this drug, like antidepressant. If a patient is using antidepressant and then he are going to use contraceptive pill, then the antidepressant will increase, so we need to decrease the antidepressant drug, and also sufenyline also, and beta blockers and diazepam, like that. What are the disadvantages of combined oral contraceptive pills? Need for daily ingestion of pills. This is one of the major disadvantages. The woman should remember daily to take her tablets, and this is a problem of compliance. Patient selection, as I told you, some patients are not eligible to use, as we discussed in the previous lecture, eligibility criteria. Some eligibility criteria 1, 2, and 3, and 4 in the previous lecture. And so we need to select the suitable patient for the suitable treatment. They have some adverse effect, but it is low, not too much. Cost factor, some tablets are expensive. Drug interactions, as I discussed before. And they found that there is some slight delay in the fertility. Let us to discuss some minor effect of combined oral contraceptive pill. It can cause, for the patient, can cause nausea, breakthrough bleeding, intermenstrual bleeding, or create oligomenorrhea, breast changes, vaginal discharge. Headaches can cause headache, colwasma, weight gain, acne, and oily skin. And this minor side effect. Cervical erosion, candidial vulvaginitis, cholestasis, psychosexual trouble. The major side effect, cardiovascular disease, myocardial infarction, ischemic stroke. They found that those who are using oral contraceptive pill can develop these conditions: hemorrhagic stroke, venous thrombosis, and hypertension, and impaired lipid metabolism. Also, they found there is a relation between using oral contraceptive pill and cancer, breast cancer, cancer of the cervix, liver cancer, also diabetes. One of the risks of using contraceptive pill for a long time, diabetes, and their effect on lactation. And they found that if accidentally the woman used the contraceptive pill, can create some teratogenesis if she does not know she is pregnant or not. There are newer preparation of combined oral contraceptive pill. This like Yasmin, and this Yasmin is called officinal estradiol 30 microgram and drospirenone 30 milligram, and Dianet, officinal estradiol and cyproterone acetate, also seasonal. This is extended cycle length, 84 tablets, 30 microgram phenylestrol, levonorgestrel, 150 macrogram. Drospirenone plus phenylestradiol. Phenylestradiol is the estrogen part of the tablet, and instead of progesterone, they are using drospirenone. Drospirenone, it is a newly synthetic progestin related to spironolactone, and it has got anti-mineralocorticoid activity. We use in decreased salt and water retention, but increased potassium retention. It has partial anti-androgenic activity by blocking the binding of testosterone. The efficacy of this combined pill is 0.55 HWY, and indicated in sometimes in premenstrual syndrome and premenstrual dystrophic disorders. The other pills, neural pips, is cyproterone acetate plus phenylestradiol. As I told you, phenylestradiol is a progesterone, is the estrogen part is constant. The difference in progesterone part. This is what we call Dianet. It inhibits also anti-androgenic, inhibit testosterone and dihydrotestosterone action by binding competitively to intracellular receptors, thus reducing the nuclear concentration of free dihydrotestosterone. It has also anti-gonadotrophic action and indicated we can use it for the treatment because of anti-androgen activities. We can use it in the treatment of hirsutism and acne, and also in polycystic ovarian syndrome. This seasonal, one of the newer tablets, is extended cycle lengths. As I told, it composed of exenil estradiol plus levonorgestrel combined pill, 48 tablets. It's used for certain medical reasons. How to prescribe combined oral contraceptive pills? Careful patient selection according to eligibility criteria, which we discussed in the previous lecture. Either the patient can use the tablets or can use the pills, or can use it with caution, or cannot the advantage outweigh disadvantage, or not to be used as category 4. Then we need to start the first pill by day 1 of the cycle. As you know, the cycle starts from the first day of menses. This is day 1. You should start your tablets. One pill to be taken at the same time every day for 21 days, but in very low dose, you can use more than 21 days. In a 28 pill bag, usually the strip contains 28 this bag contains 28 pills. So the last 7 pills are usually iron or placebo, so as the patient can remember to take the pills. Continue clinic in the cyclic intake for as long as contraceptive is there. As long as the woman wants contraception, she should take her pills. No, don't stop the pills. Efficacy, they found that 0.3 to 0.2 to 0.3 HWY. Now, what will happen if you missed one pill of this combined contraceptive pill? What will happen? This depends on the number of pills missed and the time since you missed the pill. If a woman misses the one pill more than 24 hours, if she misses one pill, she should take the missed pill now and then continue contraceptive cover and normal pills. If she forget her pill for 24 hours, one pill, immediately once she remember, she should take the tablet. And emergency contraception is required only in the first week. If this pill is missed in the first week, usually the menstrual cycle of a woman is divided into 4 weeks, from 1 to 7, and from 8 to 14, and from 15 to 21, and 21 to 28. The first week, if the missed pill in the first week, emergency contraception is required only in the first week. If more than 2 pills, if the woman missed 2 pills, she should take immediately the last pill now and continue as usual as she is taking her pills. If she missed 2 pills, she needs other contraceptive cover or added form of contraception like condom, or to avoid sex for at least 7 days. May need emergency contraception if in the first week, day 1 to 7. Now, if I will remind again, if the woman missed 2 pills, if she missed 2 pills, immediately take her pills and continue her contraceptive cover, and she must use another form of contraception, either condom or either to avoid sex. And she may need, like 1 pill, she may need emergency contraception if these 2 pills during the first week. No action is needed if in the second week, day 8 to 13. If from day 8 to 13, the second week, no action is needed. And to start the next pack without break if in the last week, day 14 to 21. If in the third week, in the last week, then she should use without break. Before I told you that the bag is composed of 28 tablets. The last 7 tablets, this is what we call the break. Also, there is some important point. More than 7 pills are remaining. Finish the pack and have the pill free interval. If the 7 pill is remaining in the tablets in the pack, then finish these 7 pills and have the free interval or the break. If less than 7 pill remaining, finish the pack, no pill fill interval. Progesterone only pill or mini pill. This is progesterone only pill, BOP, what we call mini pill. This is usually composed of progesterone, desogestrel 75 microgram, or levonorgestrel or norgestrel or norgestrone. This different type of progesterone compose the mini pill. As I told before, we discussed the combined pill. It is composed of 2 hormones, estrogen and progesterone. The mini pill or progesterone only pill, it is composed only 1 hormones. It is progesterone or synthetic progesterone. This which I mentioned in the previous slide. And the dose in the previous slide here again, either 75 microgram liner. How it will act? Previously, combined oral contraceptive pill, we told that it acts by preventing ovulation, by change cervical mucus, and prevent implantation. Here, the progesterone only pill act by letting the endometrium unreceptive, changing the endometrium and prevent implantation. Also allows the cervical mucus hostile and the sperm cannot penetrate the cervix. Also, they found that it has some effect of preventing ovulation. How you can prescribe progesterone only pill? You should advise your client or your user to take this tablet daily from the first day of the cycle and continuously without break, not like combined pills. No break here, continuously. And there is a 3-hour windows, and some tablet or new tablet like Cerazet, it will 12 hours. This means that up to 3 hours you can use it. You can use the windows. We mean that up to 3 hours you can take the tablet and no problem or no defect can occur. And some tablet like Cerazet, up to 12 hours you can use the tablet. But better to use the tablet in the same time daily. These are the types of Cerazets, what we call desogestrel 75 microgram, no androgenic effect, no ectopic pregnancy, no effect on carbo and lipid metabolism, and failure rate is 0.21. Advantages: no side effect of estrogen. Advantages over the combined. Combined we saw before estrogen and progesterone. Here progesterone only. So any disadvantages of using estrogen here is avoiding. So advantages: no side effect of estrogen and can be taken during lactation, and it can be also this progesterone only pill can be prescribed in hypertension, diabetes, epilepsy, smoking, and thromboembolism, and in fibroid. But they found also it has some disadvantage. Most disadvantage due to androgenic effect like acne, breakthrough bleeding, amenorrhea, simple ovarian cyst. Failure rate it is 0.5 to 2 HWY. Progesterone only injectables. Another form of hormonal contraception, which is was injectable injection. This is progesterone only injection, and instead of giving in tablet, we can give it in form of injection, and we give contraception for 4 weeks or 1 month. This is what we call debut medroxyprogesterone acetate. The dose is 150 microgram IM every 3 months. It will can give prevention of pregnancy for 3 months, and there is some types of injections which can give contraceptive effect for 8 weeks or for 3 months. It depends on the types of the injection. Here, this is debut medroxyprogesterone acetate. DAMBA is can give pregnancy for 3 months. This means that the woman need to take injection every 3 months. But it has some side effect like intermenstrual bleeding, amenorrhea, can create amenorrhea, and delayed return to fertility. If you are using injection for a long time, when you want to get pregnant, it will take some time. And also they found that it will affect the bone density and osteoporosis. Efficacy of the injection is 0.3. Progesterone only injectable also has advantage and disadvantage. What are these advantages? Advantages is safe during lactation, can use it safely, and compliance is good because you are using it every 3 months. No estrogen part, and so avoid the complication of side effect of estrogen. Menorrhea reduced, dysmenorrhea reduced, BID reduced, endometriosis reduced, ectopic, and also will detect agonist endometrium, CA endometrium, and CA ovary. Another form of progesterone only build, only hormonal progesterone, only hormone contraception is norplant. Norplant, this is what we call levonorgestrel, 140 microgram in each rod, and releases 50 microgram daily, and this was inserted subcutaneously or under the skin. Another types also called implanon. This also is a rod inserted, as you see in the picture, in the single rod, not like norplant 2 rod. This is single rod, size 4 centimeter. It releases constantly progesterone, and it live for 3 to 5 years. Give protection 3 to 5 years. And efficacy is 0.05. Another type or important type of contraceptive method is levonorgestrel intrauterine system marina. I talked about this in the previous lecture. It composed of levonorgestrel 52 milligrams. It releases this daily, constant, and I explained all this in the previous lecture. And one of the most important advantage of this, it can be used for those who are having heavy menstrual bleeding, like menorrhea, or can be used in hormone replacement therapy, and many uses. Is one of the most important contraceptive methods. Another form is NuvaRing. This is NuvaRing. It is combined hormones, either contains ethinyl estradiol. As I told you, ethinyl estradiol is constant in most of combined contraceptive methods, and etonorgestrel 12 microgram, and it is 5 to 4 centimeter in diameter. And NuvaRing, as you see in the picture, inserted and to be put in the vagina for 3 weeks, inserted by the woman inside the vagina for 3 weeks, and after that removed for the week for the break, and the woman start to her regular menses. The disadvantage, no protection from sexually transmitted illnesses, and some side effect as combined oral contraceptive, because it is composed of 2 hormones. Sometimes vaginal discharge because it is a foreign body inside, it leads to vaginitis, and sometimes expulsion. And the ring remains outside for 3 hours or more. Backup contraception is required. If the ring just remain outside, if it expelled for certain reasons and stay outside for 3 hours, you need backup contraception. Another method of contraception is EVRA. This is transdermal contraceptive patches, or we call it patches. Patches, as you saw in the picture, this contains phenyl estradiol and norgestromine. Transdermal contraceptive patch is composed of 2 hormones and can be worn discreetly on any area of the body, provide protection if worn on the first day of menses. The woman can wash, should be worn continuously for 7 days, change it on the 8 days for 3 weeks, and for 3 weeks, and the 4th week, this is the, as we told you before, is the break for bleeding and for menses. 1 batch 3 weeks. There will be 1 batch 3 weeks, similar like contraceptive pills. Does not interrupt with sexual pressure like Nuva rings, can be worn during swimming, and women do not have to remember. And effectiveness is 99%. Now in the coming slide, I am going to talk about emergency contraception. Emergency contraception, this means that to prevent pregnancy if unprotected sexual intercourse. If a woman has have unprotected sexual intercourse and need to prevent pregnancy. The principle of emergency contraception depends on 2 things. 1, implantation of the fertilized ovum occurs 5 to 6 days after fertilization. As we know, after sexual intercourse, the sperm migrate to the fallopian tubes and the ovum from the ovary, and fertilization occurs. After fertilization occurs, then the zygote migrate through the fallopian tubes till it reaches the endometrium. This journey took 5 to 6 days. This interval provides a good opportunity to prevent pregnancy, even after fertilization, either before fertilization or after fertilization. How does it work? Emergency contraception, the tablet or the method using to prevent emergency contraception or to prevent pregnancy, it prevents ovulation, either releases of the ovum or delay it, or interfere with fertilization of ovum by the sperm, either prevent ovulation, either prevent fertilization, or can prevent implantation. We have many regimes. This the first one is called the SB regime. This is a form of tablets composed of 2 hormones, estrogen and progestin, 100 microgram phenyl estradiol, and 0.5 milligram of levonorgestrel. You need to take 2 pills to be taken now and after 12 hours. The second 2 pills. Usually they found that prevent pregnancy by 74%. If sometimes you can use, or a woman who want to make to prevent pregnancy as a result of unprotected sexual intercourse, she can use combined oral contraceptive pills. She can use 4 tablets from low dose contraceptive pills, 4 tablets after the coitus, and followed again by 4 tablets after 12 hours. All these tablets, SB regime or this, should be taken during 72 hours, during 3 days of the sexual intercourse. And they found that the pregnancy rate is less than 1.8. But the disadvantage of this emergency, because a group of tablets, they found that can cause some nausea, some vomiting, and you should prescribe to the patient anti-emetic. Another form of emergency contraception is progestin only. This 2 doses from 1 tablet, and either single tab 1.5 milligram of levonorgestrel, using it as single dose. But also still the problem of, or the side effect of, nausea and vomiting by SB. Still there is a side effect of nausea and vomiting, and you should prescribe anti-emetic. They found that they prevent 85% of pregnancy. Another types also of this progestin only pills, what we call AC2 or pill. This is the name of the commercial name, and pregnancy rate 1.1%. May also act by delaying ovulation, beside effect on endometrium. And progestin only 1 dose. This is what we call, I think, I pill. Also composed of, is a single tablet composed of 1,500 microgram or 1.5 milligram of levonorgestrel. Also, all, as I told you before, this should be used during 72 hours from the unprotected sexual intercourse. What will happen if the woman came after 3 days or after 72 hours? What is there any method? Yes, she can use IUCD. They found that insertion of IUCD can protect against pregnancy. You should insert IUCD within up to 5 days of unprotected intercourse, which will prevent implantation. The pregnancy lasts from 0 to 1%. But there is some limitation, as you know, for IUCD. And the IUCD should be kept inside until the next period. And it is suitable for selected patient. Now, as I told before in the last slide, I am going to talk about also family planning method, like surgical family planning method, like sterilization. This either for male or female. Vasectomy for male, tubal ligation for female. Female can be done by mini laparotomy, small opening in the abdomen, or through laparoscopy, or by hysteroscopy. Both. Male sterilization, this is vasectomy. This is a very simple operation, division of the vas deferens. You know that the sperm transmitted from the testicle through vas deferens and epididymis, and for ejaculation through this channel. So, vasectomy to interrupt this passage, or this tube, by division of or occlusion of the vas deferens. We are using either clefts, dithermy, or injection of a sclerosing agent. The success of the procedure is verified by the absence of sperm. After you done the procedure, then you will do a sperm analysis. And we need to consecutive sample collected at least 4 weeks with azoospermia. Contraception must be continued until confirmation of 2 negative semen result has been achieved, and this is done after 16 to 18 weeks of performing the vasectomy. This means that you need to use contraceptive form of contraception and to do seminal analysis, and you found azoospermia 2 consecutive sample 4 weeks apart. Female sterilization, you know that, as I told before, ovum from ovary to the tubes, fallopian tubes, and fertilization occurs in the fallopian tube, and then transmission. Female sterilization, and this is one of the permanent methods, as I explained in the previous lecture, and you need Female sterilization is done by surgically by blocking the post-fallopian tubes either by three ways. Either by laparotomy, as I told, small opening in the abdomen and reach the fallopian tube and close the fallopian tube, or by hysteroscopy through the vagina, or by laparoscopy, and sometimes could be done by laparotomy. Tubal ligation or tubal occlusion can be done either by ligation, symbol, as you know, in the operation you remove the tube, cut the tube and ligate the tube and cut it, or by electrocautery, by polar dithermy, or by ring, also can be done by ring, clips also, or by laser or Isure system. Isure system is a small metal and fiber coil inserted inside the fallopian tube and some inflammatory reaction which lead to closure of the tube. Here I will show you a picture. This is on the right. This is a clips, and here tubal ligation, and Isure here by inserted by hysteroscope inside the fallopian tube. For all this information and for further reading, you need to go through these references. Thank you very much for your watching and hope to see you again in the next lecture. Goodbye.